Hi, so welcome everyone. So as you all know, right? So I'm Arindam. So we'll be presenting something about HIPAA compliance and why it is needed in today's healthcare applications. So let me share my screen and we can start. So that's the topic, right? Building a HIPAA compliant healthcare solution. And the agenda again is pretty simple. I've tried it to keep it as simple as I can, right? So for what is HIPAA actually? Why do you need it in today's modern age healthcare application, and how you can implement it technically? So, I mean, starting with it, I think a lot of buzz have been created throughout the last few months about HIPAA. So we started GeekCare. I think most of you are aware about that. It was a in-house telemedicine applications. So it started as a POC, and then we sort of was able to make it a bit of make it properly, so that the expectation also like started getting higher from the business end, and we tried to make it sort of a showcase application apart from a POC, right? So at the beginning, I mean, we did not even know about HIPAA, or these things were not included. But at a later stage, when we understood that, yeah, a potential, phase of the application would be to make the HIPAA compliant. So then we started looking into it, and then we started experience. Like experimenting more on HIPAA. So that's where I'll cover it in today's thing. So HIPAA basically stands for Health Insurance Portability and Accountability Act. So it's an US federal law. Also that connect. I mean that it's concentrate more on data security and privacy part of it, right? So it's more about patient health information, how secure you can keep your patient information, right? And basically across communication, across channels while communications are happening, what sort of security protocols that you should follow, and how you can make the information secure enough so that that does not get publicly available to everyone. So it has a official definition, and then I have kept it over there. You can just have a look into it. The other thing, which is not directly like associated with HIPAA, but it's a part of I would say HIPAA is a subset of that. That is the HL7 organization. So the HL7 organization is a non-profit organization which majorly concentrated on the communication channel of it. So anytime like you are exchanging some communication or sharing some data, that sharing some data on some electronic channel, right? The way you should share the data, or the protocol that the data should follow while communicating from one source to other. So HL7 basically keeps its eye more onto that part, right? So it's more I would say on the messaging part of it. But then when it comes to HL7, like it also like one of the responsibilities also to make the data HIPAA compliance, right? So data, when I say data, the data feature basically like getting transferred via HL7 protocols. So those data has to be HIPAA compliant. So these two are the major entities, I would say, in the entire scenario. Cool. So coming into it, a deeper look of HIPAA. So if I mean over the internet, you'll be finding a lot of like different sources about HIPAA, right? Or different articles, different terms. But then we sort of tried to accumulate things together, and we found out that these three are the major safeguards wherein you can control your informations, right? So the first one is administrative, wherein the examples can be risk assessment, assigning a privacy or privacy official, or like train your staff properly. The physical safeguards again are very obvious, which is some alarming system, security system, locking the files or the areas wherever your informations are stored. And a technical one is the something like which we have discovered and we are going to talk today, right? So the examples of the technical HIPAA safeguards are data encryption, antivirus, automatic log off, again a part of the security, and audit control. So coming to the entities who needs to be HIPAA compliant is basically covered entities and business associates. So covered entities here you can understand as the entities that the patient usually interacts with, right? Say for example my hospitals or my doctor or the clinic that I used to go to. So these things are these things comes into covered entities. The business associates are basically the I would say the technology partners or the associates that the covered entities work with to be able to build a custom technical solution, right? Which is over the internet in most of the cases. So someone like GeekyAnts is a business associates. So it's important to understand from a business associates points of view as well, that we also fall into the HIPAA compliances guidelines. And end of the day, like if we are building a software for healthcare nowadays, it's equally important to be to basically maintain the compliance guidelines in this case. Now, the other important term here is EPHI or like PHI. So it stands for Protected Health Information, and it's basically any sort of information, right? That the any sort of informations with respect to the patient, that is basically like shared across, right? Maybe with your hospitals, maybe with your doctor, maybe with your personal caretaker, maybe some other third party service provider, all these things. And anything like any health information which is stored electronically is EPHI, obviously. The rules, they basically, there are four major rules, right? Which is of HIPAA. Number one is the privacy rules. Second is security. Third is breach notification, and fourth is omnibus rule. Now, the privacy rules is something that applies only to the covered entities, not the business associates. The reason behind it is, if you look at, right, so the covered entities, as I said earlier, right, the maybe the hospitals or the primary, I would say, healthcare partners of your, right. So they have the most amount of, I would say, access to your sensitive informations, right. So they also has to sort of define the bridges and gaps between the data sets, right, that are getting shared across, right. Say for example, like as a business entity, when I'm working with some hospitals, right, so it's up to the hospital that how much data, with respect to to a particular patient, they will share, right. So that's where privacy rules comes into picture. The security rules is again like which stands for both the business associates and the covered entities, and it says more about or focuses more about handling the PHI or the protected health informations that they have. And the breach notification rule is again like it's again like associated for both, and it basically tries to identifies the data breach containing any sort of your PHI. The omnibus rule is something that mandates the business associates who are working for some healthcare application must also be HIPAA compliant. The reason behind it is again very simple. Like unless, say for example, I know what HIPAA compliances are and what sort of compliances I should follow in the healthcare applications, I won't be able to make the solutions HIPAA compliant, right? So once that fails the HIPAA checklist, probably the particular business partner that I'm building the software for would not be able to even make use of it, right? So that's where the omnibus rules comes into picture. Now, think of something, right, in today's era, normally, right. So as a normal human being, I visit to a lot of doctors, clinics, hospitals in sometimes, right. So whenever I face any problems, basically, now like the data flow, if you look at this graph, right, so the data flow are both ways in most of the cases. So I go to my doctor's office, and from the doctor office I might be referred to a hospital, right. So the doctor's office and hospitals might have all the informations that like I am facing right now. I mean, the information is related to the issue or the disease that I'm facing right now, that's fine. But then if you look at some other specialist, or like some skilled like nursing facilities, or even the tech partner, they don't get to know, right, what sort of problem exactly I'm facing, or like how long I'm going a treatment for, right. I might be facing some sort of sensitive I would say I might be undergoing some some treatment which might be sensitive enough, right. So at some point I would also probably might want not to disclose those with everyone. But then that somehow does not get does not exist right now, right. So it's more over a open ecosystem nowadays. So most of the times I work in is with like the file that I have, of which is most of the cases again hard copies, or even like say for example, if I'm going through some third party applications, most of my sensitive informations are still open, right. So the doctors or anyone else, right, apart from the doctors as well, can be able to access my data and understand or read, basically, right, what sort of treatment I'm going through. So that's basically a scenario without HIPAA, and that's where we are trying to modify, or that's where HIPAA can come in and make your informations more secure, make your data more secure, I would say, so that it doesn't get populated throughout the internet openly. Cool. So that's cover, I think, the why part of it as well. So probably you understood why it's important in today's era to make your application HIPAA compliant. The next thing is again coming back to the geek care, which is the major like topic for us today. So as I said earlier, right, the moment we started geek care, it was more of a like in-house POC. We started working on it. That product, like we were able to deliver. I mean, develop the product pretty well, and then we sort of I mean tried to look into the bigger picture, right? So what other like modifications that we can do on the existing product to make it a better version of itself. And at that time, we also came to know, okay, like we have to make it HIPAA compliance to be able to pitch it to anyone else apart from GeekyAnts, right, or any other business entities. So we tried like accumulating data on HIPAA, and these are the steps that we followed to make GeekCare partially HIPAA compliant. Now other thing is, right, if you look over here in the title, right, I've made it partially intentionally. So the major reason behind it is, like, as of now, GeekCare is not again a full-fledged application, or I would say not a deployment ready application, right? It's not a live application. So we are yet to work more on that. But then so far, the scope that we had in the application, we made it a HIPAA compliant. So that's why I have mentioned partially over there. So now we like started with it. Like I think like the entire team went through the HIPAA training, wherein we came to know different like terminologies, different use cases of it, right? Which sort of data should be protected, which sort of data should not be protected or can kept open, etc. The second thing is, again, like we chose like strong password hashing algorithm, which is hard to like traverse back. We like implemented role based authentication, which also gave us authorized access throughout the applications. And then we basically encrypted the sensitive files in the server side. So these are the 5 major steps that we followed to make the application HIPAA compliant. Now I'm coming to the implementation part, right? Starting with the role-based authentication, right? So for say, for example, I have two tables, right? Appointments and time slots. Now, if you look at from the typical use case, right? So appointment is something which should be accessible for both by both parents and I mean sorry, by both doctors and the patients, right? Appointment table must have the permissions, I mean must allow all, I mean, this sort of users to read and write over here. So that's why, like, if you look at here, right, the physician and member both have sort of permissions to insert and update the data over here with some custom checks, obviously. On the other end, the time slot is something where the physician, the doctor, is making his or her time slots available, and then the member does not really get a lot to see over there. So, right, so he or she just has the selecting permission over there in the time slots table. I mean, they cannot update it, they cannot insert the data point as well in the time slots. Now, like coming to the front end implementation part of it, I hope the screenshot of the code snippets are visible enough. So basically, like, we created a Hasura link, right, wherein we are passing the X Hasura admin secret, and basically before that, right, we are basically trying to get the authorization tokens. If a user is logged in that case, like, I will have the authorization token stored. If not, so I'll be like using my session, and from the session I'll attach the authorization token to the headers. Along with it, I'm basically passing the admin secret of Asura, right? Just to inform you guys, yes, we had a detailed like a session on GeekCare earlier. So if at any point you guys want to know more about GeekCare, how we built it, the tech stacks, you can go ahead and refer to that video. So that is available in the YouTube channel also, I guess. Cool. So coming back here, after that, like we created the link, the Asura link, wherein basically it returns me the headers in the HTTP link. And then we passed the same role ID that we were talking about to in the JWT as well. So this is a decoded version of my JWT. That's how it looks like. So for this particular user, the role is member, right? And the allowed roles, if you also look down, right, in the JWT claims, we have also passed the allowed roles over here. So right now we're accepting only two sort of roles, which is member and physician. And for this particular user, the role is member. So it will ensure that only if the member role, I mean only if, say, for example, this user Arindam Ganguly, he's like having a member roles, right? So he would be able to access only the routes which are specific to the member and not to the physician, right? And vice versa. Say, for example, if this role was would have been a physician, then the physician, I mean, then the route for the member or the applications part or the modules for the member would not have been accessed by the physician. So the other thing we did is basically, like encrypting our file server side using AWS KMS. So earlier we were using something like something called Cloudinary. primarily because of the free data store over there, so it gives you up to 25 GB of free data. So the point we realized to sort of encrypt our data server side. So it started first like on a traditional way of like making your files password protected in the client side, and then upload that file with some sort of allies or like data point, key point to, wherein it will be basically uploaded to the Cloud Identity console as a password protected file. So the admin, like someone of admin or super admin, if I have the access or the super admin access throughout the system, I might be like able to view it, but I won't be able to read it, right? So I might be able to access it rather, but I won't be able to view or read it. But then that did not really work out for us, because we could not able to find some password protected support, file upload support in Cloud Identity or something. So we had to move through S3 back then. And then like we like decided to go ahead with KMS, right? So now how KMS work is, again, like that's a separate thing, so I haven't sort of like discussed it that in these particular slides. But then to sort, like KMS is called for like a key management service. So it's an service provided by your like AWS by default. You can like have two sort of keys over there. One is symmetric, one is asymmetric. Now, a symmetric key is something wherein you don't need a private key separately, right, to decrypt your file. So basically, it's a single key, and you pass the key specification and the metadata of the file. So the time you request that file to decrypt, so the file contents already has its metadata, and from the metadata, it tries to understand, okay, this file is something which is having the KMS key ID. So this key ID over here, I think, is very vital. So this is also what we are going to use throughout the applications, right? So this has the key ID, and then it will decrypt it. On the other end, like if you want to make it more like secure, I would say, you can use a asymmetric key, wherein you have a private key separately. So you can only basically like decrypt the application, decrypt that particular file with help of the private key. And then like just one information over here is, make sure if you are using KMS, you have the necessary permissions. You can follow the AWS official documentations as well. So it has to have some sort of necessary permissions for the IAM users. And if you are not having, so make sure that you contact the administrator and get those permissions. Now, I think at the very last, so this is the implementation level of the encryption using KMS, right? So here again, like we have majorly three functions, right? One is the encrypt file. One is the upload with the upload file with KMS encryption, and the other one is the file. Upload that encrypted file to basically S3 bucket, right? So in the generate key, like again, if you look at, right, so using this algorithm, AES 256 CBC to encrypt the file. So once we basically encrypt the file, we are basically like uploading that file to the S3 bucket. Which, although like just a thing to mention here is this. This S3 bucket that we are talking about is an open bucket. It's not a private bucket. So private bucket, you can implement the same thing in the private bucket as well. But as of now, we have kept the bucket open. And in case of you are using a private bucket, you can also select the sort of user groups that are able to access the bucket. So I think that would be again like a step better solution, I would say. But again, depending on the use case. So we did not have that use case right now, because like we had very limited data as of now, and mostly like it's not real time data, right? We just had to do up hands on that. So, and we did not opt for a private bucket at this moment, because it did not make any real sense to us. So the other thing is like data key and your KMS like key ID, right? These two are different things. So data key is something which are mapped to your individual files that you are uploading. So it's something like an unique identifier of that particular file. And your KMS key ID is basically a single ID which is going to map through all the files that you are uploading, which is again like is playing the vital role to decrypt your file in this particular case. Both encrypt and decrypt, I would say. And then once your this thing is done, like once you have your encrypted file, so we are just uploading it to the bucket with a particular key, right? In the body we are sending the encrypted file data that we are sending, and in the metadata we are basically attaching the KMS key ID over here. So the next time it tries to decrypt, right, so it knows this metadata which is present in the file itself, and it decrypts it alongside as soon as it gets the request from, right? So as a result, it decrypts the file and then returns you back the decrypted file. Just last thing over here is if you look at this particular use case, this particular like screenshot, right? So this is the bucket where I have implemented my encryption, right? So it's a basically screenshot of a single file. So as soon as I click on a file from my KMS enabled file system or my from my private file system, I would say not private KMS enabled file system. If I try to open the link, it shows me the access denied error, right? The reason behind it is again like it opens in the browser, it tries to access that file, but then it says sees that this user does not have that particular role and the KMS KMS key ID basically to access this file. Although I am able to access it, but then I'm not able to view it properly or like read the file definition. So that's like the pretty much short implementation of it. I think I have come almost at the end of it. So these two were the major things that we considered at this point to make the application partially HIPAA compliant. Of course, there are a few other things. There comes on the so for example, there are things called FHIR, right? So which is again which concentrates again more on how you should structure your data, right? So that the data is available across platforms, but then in a secured way, right? So that is again like a separate discussion. We can probably have it someday or the other. I think someone Gaurav Porwal also had a session on that, right? So all these things again like are not a part of the application in the current scope, but probably we'll take it at some point in the future. The last thing I would want to say before ending is we have implemented it in like Next.js and Hasura, but then HIPAA is something which is not technology specific. So it is just a set of rules. It gives you a set of rules. Now it depends on you and your tech stack how you are gonna implement it, right? So as long as those rules are getting I would say satisfied, you can basically go ahead and implement HIPAA in any sort of language or framework that you are developing your applications. The major concentration of HIPAA is again to protect the patient's sensitive informations. So it does not have anything to do with respect to particular technologies. I think yeah, that's all from my end right now. If anyone has anything, any question, you can just shoot out to me. I'll be happy to answer those.